Good morning, good afternoon, and good evening to everyone in the Pasteur Network community. And Happy New Year. I wish you all the best to all the members of the community as we embark to another year of opportunities and collaboration. Welcome to this new Pasteur Network monthly seminar. As usual, we'll begin with our speakers and then we will follow it by a Q&A session. You are welcome to drop your question in the chat at any time or ask them directly during the Q&A. And remember, please, to keep your microphone and camera off during the talk to ensure a smooth experience. The session is recorded and will be soon available on our YouTube channel. Today, we're going to talk about a cross-cutting topic that has become increasingly important in the post-COVID era: turning science into influence, advancing poverty-related and neglected disease (R&D) in global health policy. For that, I'm very pleased to welcome our two speakers, Yann Illiaquer and Lucile Hermant from Global Health Advocates. Yann has a degree in international public law, strategic negotiation, and diplomacy. He joined the Global Health Advocates in October 2020 with previous experience in global health. He worked on advocacy for Coalition Plus and the 5% initiatives, the indirect contribution of France to Global Fund to fight HIV, AIDS, TB, and malaria. Before joining the Global Health Advocates, he also coordinated the French NGO platform Coordination Sud, Health and Development Finance Committees, and the Working Group on the French Law Programming International Aid and the Fight Against Inequalities. He is now analysis and advocacy coordinator at Global Health Advocates. Lucile she's analysis and advocacy officer, and he has been advocated for international solidarity for 5 years when she joined Global Health Advocates in December 2023 to defend health equity. Her experience has convinced that civil society organizations play an essential role in making sure that effective health systems are accessible to everyone. After a master's degree in public policy at the Paris Institute of Political Studies and a number of internships in international institutions and NGOs, Lucile worked for 2 years in Niger with local elected officials to implement the national policy and nutritional security. She also went to Romania and Poland to work on Ukrainian refugees' access to social services. In addition, she advocated in France for the involvement of civil societies in decision-making when it comes to health and malnutrition. Okay, so now before I give the floor to Yann and Lucile, I would like to say a few words about our knowledge-sharing platform called PRNDs. We launched it early October, and we are already almost 800 users. And some of you are here registered on and are already using the platform, and we are very grateful for that. This platform is open to absolutely everyone within the network, researchers, students, and support staff, and completely free of charge. I'm really encouraging you to register on PRNDs, to explore the platform, introduce yourself to the community, and connect with other users, join groups, and gradually begin identifying new opportunities and build new collaboration. Thank you very much. I'm giving the floor now to Yann. Yann, you can share your screen.
Thank you very much, Hichem. Really honored to be with you all today. Thank you for the introduction, and I will start immediately. So you already seen the title of the session we talked about, and here is a brief outline of our presentation today with Lucile, something we thought about preparing for the session with Hichem. So we will start by introducing you on what is our organization, Global Health Advocates, or GHA, as I will say in short, how we advocate, because this is our main goal, to influence public policies both in France and the EU, but I will come back to that, giving you a few examples of successful or less successful previous campaigns of advocacy. And then in order to open the Q&A and discussion part of this session, a quick overview of dimensions of global health and the political agenda as we are foreseeing it for 2026, trying to see how we could potentially collaborate in between GHA and the Pasteur Network in the coming month. So starting immediately with what is Global Health Advocates, GHA? GHA is a French NGO that had been created a little over 15 years ago. And our goal is to help build the world where everyone
Yann, I'm sorry. I'm not sure we see a screen. I think you stopped sharing the screen.
Really?
Yeah.
No, we can see the screen.
No, we can see.
Okay, but
We
so
can see
it's
the
only
screen.
me.
No,
I'm
I
sorry.
can see it.
Okay, I'm sorry.
I can't
It's
see
me.
it
Go
anymore
ahead.
on the slide. Who is Global Health Advocates, right? Great.
Yes.
Thank you very much. So as I was saying, we are a French advocacy NGO created a little over 15 years ago. We were debating with Lucile on the creation date a little before we started. I think it's a little previous to 2011. As I was saying, we are a political advocacy NGO. We are a rather small team of 15 members, but it's actually rather big for focusing on solely on advocacy. Our main driver is the fight against health inequalities all across the world. And as we know, health threats are disproportionately affecting the most vulnerable and in majority in the poorest and least developed country. Our advocacy, although it's based in France and the EU, is targeting the support this country and this regional organization can have addressing health inequalities all across the globe, and thanks to their international cooperation policies, especially what's happening in the so-called Global South. Moving on to the next slide. Sorry, I'm not... Yeah, are you seeing the following slide? Sorry, I have a little issue.
Yes,
It's okay.
on now.
The fourth one.
You saw the change, right? You have a picture now. Okay. So 15 members among our team, divided in 2 offices, one in Paris and one in Brussels. So our main advocacy targets, the decision makers we are trying to influence, are both at the French level and at the level of the European Union institutions. We are spreading our advocacy among a wide range of decision makers and stakeholders. So it starts with obviously the ministries of foreign affairs, health, and the EU commissioners on health and international cooperation. But we are also working with public agencies such as the French Development Agency here in Paris, but also research institutes and members of parliament. We are working a lot toward parliamentarians as they are the legislative body, both in France and the EU. So if we want to properly influence decision making, it's important to have them on our side. GHA is a founding member of the Action Global Health Advocacy Partnership, which is a network of a few dozen peer NGOs based in the US, in the UK, in Canada, in Italy, but also in India, Tanzania, Kenya, Ivory Coast, Zambia, and I will forget South Africa and other countries. It's really important for us to be part of this network and to connect with NGOs carrying out a similar advocacy toward their respective government and parliament in order to align strategies, share intel, and also find synergies in order to have a stronger common voice toward our respective authorities. Both at the French and the EU level where we operate, we are also coordinating coalitions of NGOs advocating for global health, because we are several, both at the French and EU level, doing advocacy on different dimensions of global health. Different specialties or approaches, and it's important for us to ensure some kind of coordination, to have common voices that can be better heard and listened to by the public decision makers. So it's important for us to have this coordinated approach of collective. And so this is allowing us to carry out different dimensions of what we call advocacy. I'm sure most of you are familiar with the approach of advocacy, but I can tell you it's a full-time job with many dimensions. I'm sure at each of your level you're carrying somehow some kind of advocacy because of the work you do for global health and research and development. But we do it full time and at a professional level. So we'll come back to what it means exactly or how we approach it here at GHA. But we are doing policy analysis. We are having a strong relationship with the French and EU decision makers. We're doing resource mobilization, not for us. It's important as GHA, we don't receive public money because we want to keep our independence regarding the people we are advocating toward. So when we say resource mobilization, it's ensuring stronger budgets being allocated to the fight against health inequalities across the globe. Accountability, because with our advocacy, many times we succeed in having political commitment, but it's something to have a promise and it's something else to ensure it's being kept or respected. So it's an ongoing process to ensure that the decisions that are taken at the political level are then enforced and implemented on the ground and on the long term. And as we were saying a little earlier, we're building partnerships with civil society, but also with academics and so on and so forth. We will come back with other examples on that. You're on the right side. Sorry about the technical issues. You're well positioned to know that when we say global health, it's a really wide spectrum of approaches and dimensions. So we are, as GHA, working, at least in theory, on every dimension of global health. But then, of course, we need to prioritize in order to be more specific in our advocacy in some aspect of it. So we would say that our main areas of focus are the fight against pandemics, women and children's health, including nutrition, sexual reproductive health and rights, research and development, climate and health, and the so-called global health architecture and its funding. So as you see, it's quite broad and it's evolutive. It's also driven by the discussions we have with our several partners, and in the past it had been the subject of evolution because. Just to give you an example, our peers from Ivory Coast were saying that they were facing a crisis on a specific disease, so we had to adjust our advocacy in order to push France or the EU to shift its international cooperation in order to address a specific area. In terms of R&D, as we thought that it could be of interest for you, our advocacy specific objectives are to integrate research as a central pillar of the health agenda, as sometimes it can be seen as separated approaches. It's different when you speak to the Ministry of Research than if you speak with the Ministry of Health, and even different for the Minister of Foreign Affairs. So we want to ensure that they are well coordinated among them, and that their respective priorities are going into the right direction. So that's why on the following objective, we wrote that our goal is to ensure that R&D is driven by needs of the populations rather than the profit of some private company. And overall, and especially in these difficult times, we are trying to reinforce at the political level trust in science and in international solidarity. Moving on to the following slide. What do we understand by advocacy? Advocacy is a strategy of influence on the designing, implementation, and assessment of public policies that can have, for us, an impact on global health. We want to obtain positive and long-term changes at the policy and budgetary levels, and this is Cecilia, you...
Yeah, no, I'm just, because we are seeing who is a global health advocate. You are still in the same slide, or you change it?
No, I changed 2 times already.
Now I can see what is advocacy.
What is advocacy? Okay, great. So this
perfect.
is,
sorry
about that. And you might have missed the previous one, but we will share it afterwards. So we'll make sure that you all have all the slides with you. So what is advocacy? So as I was saying, in order to achieve this overall goal, we adopt a methodic, reasoned and rigorous approach in order to ensure that our advocacy is well thought of and impactful on the long run. So we go through several step process in order to have a stronger advocacy. First, we establish a context and problem analysis in order to properly assess what is the change we are aiming at. What in the current situation is not acceptable and should be addressed. Here it's important for us to ensure we are not completely wrong about the way the messages we are carrying, and along with that we also define the way the solutions that we would like to see implemented, thanks to the involvement of France and the EU for us, but the same can be applied to other advocacy targets. This is where the work that researchers are doing is really important for us. We read a lot of research work in order to inform the way we are. Sorry, we are hearing some.
Yeah, go ahead.
Okay.
I turned off. Okay, thanks. Sorry.
So yeah, we ensure that our advocacy is properly informed by research and by our partners experiencing difficulties or unequal access to health. Then, of course, we establish a power mapping in order to identify who the stakeholders that can have a word on what's going on. Yeah. So this is what I was mentioning earlier on what ministry can have an impact on what policy, when does the parliament is going to adopt a new legislation that can influence or bring solutions to the table. So this is a really important step to understand who can influence a change and who will be in charge of implementing it, and how do they operate, what are their constraints, what can be leveraged to motivate them in order for them to care about an issue and then to act as much as they can regarding their responsibilities. Then we design targeted messages that we want to be tailored to the specific targets we are aiming at. As you can imagine, not everyone in the chain of command has the same level of expertise on different issues, and we can't expect an advisor to the Ministry of Foreign Affairs to read a 200 pages report on a specific disease. So we are writing down reports, but we keep them for the technical level staffs and at the high level political spectrum, it's more of short and impactful briefs that are designed to import their decision. And then we plan different tactics, finding allies and sustaining the relationship with the decision makers in order to be trusted and listened to. Just to give you a few examples of recent advocacy campaigns that we've carried out. On the left of your screen, you can see a fact sheet that we designed for Health ODA, assessing what and how France, in this specific example, is spending on global health official development assistance, because we noticed that many decision makers had a tendency to overestimate what France is doing, and it was really important to remind them of what they actually do and how stronger they could be if there was a better political will to bring to the table additional fundings to tackle health inequalities across the globe. The last time we published this fact sheet, it was also complemented by a survey that we carried out among French members of the parliament that was also showing an overestimation of what France is doing on international solidarity for global health. And so with those two combined, it was a powerful asset to bring to the table of the advisors of President Macron and of the cabinet of the Minister of Foreign Affairs, but also ministers of budget, to show them that many other countries are doing actually more, and that their own parliamentarians would like France to do more. So there was nothing that should prevent them to strengthen their collaboration. In the middle, I'm sure you recognize the WHO director carrying the sign of our campaign, A Dose of Solidarity, that we implemented in 2024 and 2025 on immunization. You might know that Gavi, the Vaccine Alliance, was going under a replenishment campaign. And so we had this Dose of Solidarity campaign that was complemented by many op-eds, social media campaigns, and we were taking pictures of global health or political leaders rallying around this slogan of a Dose of Solidarity. We had many EU commissioners, international partnership ministers, global health ambassadors of several countries rallying behind that tagline, and that helped us ensure then that France and the EU were actually maintaining a strong contribution to this global health initiative, supporting the immunization coverage worldwide. And the last example we brought was something we've done during the presidential election campaign here in France. So back in 2022, we wrote a program for global health that we sent to the main candidate to the presidential elections, because
Presentation has gone.
let me start again. Yeah, because Yeah, here it is. Presidential election campaigns are not a time where you have a lot of margins for big political shifts. So it was important that we were sensitizing candidates to this election. So we shared our programs with them. We've met with their teams in order to influence the design of their own program, ensuring that they would dedicate a specific part to global health. And then we send a questionnaire to each of the main candidates. And we assessed their answers. We got answers from all of them, the main candidates, and we assessed the way they were allegedly were planning on addressing health inequalities worldwide. And you can see the third on the screen. The third column was actually for Emmanuel Macron, who was doing less good than other candidates. His team was not pleased by our assessment, but at least it opened the dialogue once he got re-elected, because we were saying that he could shift different dimension of the way he was carrying his policies in order to have a better impact on health inequalities. Giving up the floor to my colleague Lucile, who will who will complement on this.
Yes. Good day, everyone. Thank you for, very happy to join this this seminar today. So at GHA, we are convinced that health advocacy and health research pursue the same goal and can mutually reinforce each other. It's particularly telling regarding R&D in PRNDs, if you'll excuse me the acronyms, because on the one hand, those diseases still represent a large share of the global disease burden. Unfortunately, neglected doesn't mean rare or harmless disease. And on the other hand, it's receiving too little proportion of global health-related R&D expenditure, less than 2% in the worst years. While Yann presented you the impact that advocates like us can have on decision-making, researchers like you also have the legitimacy and the capacity to influence public policies, legislation, and budget. You can, with your work, with your research, you advance global health public goals by improving treatments, by strengthening health systems. You can provide evidence to design policies, and decision makers are always asking about evidence before taking any decision. And you are the best placed to actually counter the current anti-science movement. That's why we should see, you and us, advocacy as being a bridge between science and public policies. To exemplify this a little bit more, and before handing over the floor to Cecilia, I hope you see the last slide I'm presenting. There are 3 pictures on it.
Yes.
Thank you. We would like to present you 3 examples of advocacy activities that we led already with researchers and that actually showed quite an impact. The first one is an open letter that was published back in 2023. There was the UN high-level meeting on tuberculosis, and the political declaration on tuberculosis had just been adopted. We mobilized activists, NGOs, but mostly researchers, and obtained more than 190 signatures to support the letter that was sent to the French government to call them on contributing to its fair share. At the UN HLM, the global financial target was to dedicate $5 billion to R&D on TB until 2030. And so the letter was calling on France to do its fair share and dedicate 100 million euros per year until 2030 to reach this goal. And it was a particularly strong call because France was also hosting the Union Long Conference a few months later. So that's a proof of mobilization between advocates and researchers that led quite an impact. The second example is a report, so No Eradication Without Innovation, that we published more recently, so in 2025. It was part of a more global advocacy, taking advantage of the replenishment of the Global Fund against HIV, AIDS, and TB and malaria. We wanted to draw the attention of donor governments, of France, of the EU, to the far-reaching impact of the fight against these diseases. And so previously, we also released other publications, a report on the impact of this fight in the promotion and protection of human rights for particularly vulnerable population. And this report was listed some of the innovations that were made in the fight against these three pandemics since the year 2000, showed how this fight was made more innovative, the progress that has been enabled thanks to research and development, and also showcasing all the potential that funding research and development would release in the coming years. And we were very happy to see that the Pasteur Network was on board to also to defend this report. And it resonated a lot with political priorities of this year. We obtained a lot of meetings with the European Commission. It was presented at the World Health Summit. Maybe I just present in one sentence because I don't want to take too much time. The last one, that's a current advocacy that we are still leading, mobilization around the Horizon Europe program at the European level. The program that should define the political and budget priorities for the next year, and we are particularly trying to influence its research instrument, the framework program number 10, and to try and have PRNDs well included in this program. And we had already a brief, an open letter as well, 80 researchers taking a public stance on that issue. And so, of course, if you have any questions on that matter, and we can send you any publication that we did in that regard. But without further ado, I will hand over the floor to Cecilia.
Hey, thank you very much for the presentation. We continue. I don't know if you can see the next slide because I'm still in the example of advocacy. So
oh, sorry about that.
No, it's fine. I mean, it's we can just move forward with the 4 points. So everybody knows me already. Thank you. Yeah, I can see. So I think
we are on your slide.
Okay, so well, thank you. Good morning, everyone. So what I'm going to just to show you here is just to use the context that Global Health Advocate just given us, and just to share with all of you and to briefly explain how we understand advocacy in the Pasteur Network and why it matters for our work. So I divided in 4 points. Just to make it very briefly, first of all, it's why advocacy matters, and I don't want to repeat myself I don't want to repeat what our colleague just said, but in the Pasteur Network, if we are thinking from our perspective, we produce together with our members high quality science every day. So, but science alone, it's often not enough to change realities on the ground. So decisions about funding, priorities, or policies are taken in these political and institutional spaces, not only or always in laboratories. So what we're trying to do is that's where it's this is where advocacy comes in. So advocacy, as it was just mentioned, is the bridge between the scientific evidence and decision making. So what we are doing is just to help to translate what we see in the field into political attention, funding priorities, and policy choices. And so for me, this is a very simple as a message for the network. It's like the advocacy we do is like just amplifies the scientific voice of the Pasteur Network, where it can have the most impact. So the second point is a transversal role across the fourth pillar. So advocacy is not a fifth pillar for us. It's just a cross-cutting function that strengthens everything we already do. Okay, so for example, in research and innovation, which is one of our pillars, advocacy helps just to shape R&D agendas. For example, as Lucie was saying, in neglected disease or in IMR, and in all related public health, it allows us just to bring field evidence into preparedness and response policies, or in capacity building. So we're just trying to advocate for support investment in research and in health systems in a low and middle income countries also. And so again, advocacy is not a separate pillar. It's a very transversal one that reinforced our mission. So I'm just trying to go quickly because I want just to make the space for people if you want just to have a question. And the third point is that the PN. So the PN is a legitimate global health actor. And this is something that maybe I would like that every one of us is aware. So the Pasteur Network is formally recognized as a non-state actor. We have official relations with the WHO. So this status gives us the legitimacy and structured access to global health governance spaces. And of course, on direct relations with WHO, but I think it's important that we all are aware of that. So it means that evidence generated by our institute can directly inform discussions on pandemic preparedness and equity on One Health at the global level. The fourth point, it's what we are doing now in concrete, because sometimes I know that advocacy could be a little abstract, but with all the examples that our colleagues just given us, and what would I like to show is what we are doing in advocacy. So I just put it a couple of examples, but we are doing a lot of things. For example, we are working with IPPS, which is International Pandemic Preparedness Secretariat, and the 10 Days Mission. We are co-hosted and contributed to scientific credibility to the fourth implementation reports on pandemic preparedness. And saying that, I take advantage to mention that we are hosting an event in Paris in end of January. Then we, for example, other example, it was the declaration, the Rio de Janeiro declaration for the G20 context. It was in November last year. It was a statement that underscored that the Pasteur Network, commitment, I'd say, to advancing global health and highlight the G20 essential role in fostering collaboration for a more equitable and world, we can say. So I was focusing in equity and preparedness. We are also supporting initiatives like ERASUD. ERASUD is a European Research Alliance for Sustainable Development. This ERASUD, it's the Institut Pasteur Paris, which is one of the members of ERASUD, and we are supporting this initiative every time that Paris thinks that we have a role to play there. And I put this example because it's not only it's not the only member that have their advocacy activities that we can support. We work also with Fiocruz and with other institutions. So if your institutions are doing some advocacy activities and you consider that we can support or help in amplifying the message, we can do this. We can work together on that also. Other two things that we are and that we would like just to highlight is that we are working together with the European Union and Africa Union in the innovation agenda. So we are we participate very actively in the discussion. And also with the government of France, with the One Health Summit. I know that our colleagues from the Global Health Advocate also. So this is going to be in the 7th of April in France. So this is just some very, very concrete and short and highlight examples. I can share all the information you would like to have, and I will upload all the statements and documents and report on the PN link. So you can just have access to all of this information. I think this is very, very important. And just to conclude, I think that we need just to see that advocacy helps to ensure that our scientific excellence, the scientific excellence of the Pasteur Network effectively informs policies, investment, and global health priorities. So it's a very strategic tool that connect our work on the ground with the decisions makers that shape global health, and it is very important in today's world just to translate what is happening in the scientific world to the politicians or to the institutional levels. And I want to stop here because I think it's for me it's fine, but I'm here if someone has some questions or would like just to have more info about it.
Yeah, thank you very much, Cecilia.
Yeah, can I say something, Yann and Lucile, because I will, just to ensure that this time of questions we'll need to speed up a little bit. So if we can finish in 5 minutes, that would be fantastic, so we can have some questions.
Yeah, no worries. We were thinking the same. We were going to go really, really quickly on these two final slides of ours, because for us it's also really important that we discuss. So in these two final slides, we were just writing down examples of global health issues or approaches that we could explore as a potential area of collaborations, because if advocacy can be an asset for research, the other way around is also really true. As Cecilia was saying, you are the one producing the high quality evidence, scientific evidences that are the seeds for a good advocacy and to influence public policies. So I'm not going to go through all of the examples that we have put. We also have an agenda of 2026 with different milestones that will be important for us, but it's more important for us to open the floor to your questions, comments, and suggestions for further collaborations.
Good. Thank you so much. I will go to the last slide, maybe. Yeah, so people can contact you. Okay, so we have a little less than 10 minutes. Noel, of course, please. Happy New Year, Noel.
Sorry, have a good year to everyone. Yes, because I have a meeting in 5 minutes. So
yeah, sure. Go ahead.
Question now. So we are talking
Noel
about.
Noel is the director of Institut Pasteur in Guinea.
Yes. You are talking about influence, and as you know, there is a big concern at the moment about the disappearing of a certain number of financing from the US in particular, And we are contacted. I was contacted, but there is many thinking that are done on that. For example, by the French Academy of Science, I was contacted, which is asking what will happen and how this can be replaced or avoiding that we have too many difficulties. The same, you are saying that you are collaborating with AFD, so the same problem exists with AFD also, and the embassies are thinking about that. So I would like to know what you are doing in these conditions, in this situation, because when I was, questioned, what I saw frequently is that the different partners that exist and give money, for example, in Guinea, you can have AFD, you can have DFG, you can have different aspects, and sometimes they are giving money in parallel without having enough connections. And so the connections between the country and Europe, for example, is limited. So we can see that also with Mercosur, etc. That's for sure. But how can you influence this in order to have a more coherent diplomacy in this? Thank you.
Thank you very much, Noel. Really nice to meet you. So really tough question you have here, because it's a really challenging environment we are operating in. First, I would say that our goal is to make our decision makers aware of the impact those budget cuts will have on an awful amount of people all across the globe. You might have seen these projections published in the Lancet that over the 5 coming years, the US budget cuts could kill 14 million lives. That's not acceptable, and it's not even taking into account all the disease burden that will have further that will call further lives on the longer run. So that's our first messages to the French authorities and the EU at the EU level too, in order to call them to step up in order to avoid what could be avoided if they were coming up stronger. But then they're telling us that they are also operate in a challenging budget environment, and their constraints are leading to also cut their own budget. So then it brings us to the final part of what you were asking: how and is it possible to do more with less, or at least in order to ensure that the money remaining is used on the most efficient way. And here we're forcing them to address the fragmentation of the channels of delivery of health funding, pushing them to better collaborate with other technical and financial partners in different countries, but also to better integrate it with the national authorities' strategies, because here also it can duplicate or even sometimes compete with the way it's implemented. So this is more of a two-level answer, sorry. So first there is the political level, where we want them to stop the bleeding of health funding, and then what's remaining on a more technical level, we are advocating for more efficiency. But it's hard to give you a full comprehensive answer in a short amount of time.
Thank you.
Thank you, Noah, for your question. Thank you, Noah, for your answer. Any other question? We still have few minutes. Even for Cecilia, she will be happy to answer. Of course.
Fine. I mean, we have a specialist here.
Okay, Umaru, go ahead, please. And can you please introduce yourself before you ask your question? You are muted, Umaru. You have to turn on your mic. Or I can do it for you. No, I can't. So you're muted, Umaru. Well, maybe you can.
Okay.
Yeah. No.
Hello, good morning.
Hello.
Maybe you can write it down, Umaru.
No, he has a problem with his mic. Could you please turn on your mic? Yeah, go ahead. It's working now.
Hello, good morning, everyone.
Hello.
Salut.
Okay. I'm Umaru from Sarmes. And
Sarmes is in Niger.
Sarmes is in Niger.
Yeah.
So thank you so much for your presentation. It's very interesting. I have just one question. I see that you are working with European countries, and how can an Africa institute like Sarmes can collaborate with you to influence policy maker or something like this? Thank you.
Thank you very much, Mr. Umaru, for your question. So as global health advocates, we are part of an international advocacy network, which includes partners working in Africa. So, for example, in Ivory Coast, in South Africa, in Kenya. And so it enables us collectively to act on decisions linked to global health with the African Union, for example. And since we were presenting the opportunities for influence coming this year, France will be holding the G7 for the whole year. And several summits will be organized on this occasion, especially one in May called the Africa Forward Summit. It's a summit between France and all the African states where health will be discussed, and that could be an opportunity to bring R&D messages on this occasion. But so that's the presentation. Then on your very specific question on how CERNES or African partners of the Pasteur Network can contribute, we are actually very open to your suggestions. We left our email addresses. Please feel free to contact us directly. We also have WhatsApp numbers, and if you want to bring a specific issue to the international agenda, but don't, well, if you have the facts and the ideas, the messages, but don't really know how to address it to decision makers, that's where we are ready to support. So if you have an idea right now, we can discuss it, or you can also contact us afterwards. Please feel free. We would be very happy to contribute on that.
And in addition, we mentioned earlier the advocacy we do regarding the upcoming European Union budget for R&D. And one of our messages is to ensure that the fundings are also flowing toward African-based institutions and not only actors from within the European Union member states.
Cool. We have another question from Marco Vignuzzi. Go ahead, Marco.
Yeah, hello. This is to build on Umaru's question. I'm Marco Vignuzzi at ID Lab Singapore. We're not part of the Pasteur Network yet, but we hope to be one day. In thinking about that, obviously there's probably no world advocacy group list, but maybe you guys would be the people that would know best similar groups of similar interests around the world, and whether it's possible to compile a list for us that might be interested in interacting with them that could be made available to the Pasteur Network in a way. Because just to see, the groups in Asia, for instance, that might be taking similar approaches country by country or by region that might link up with you that we don't know about. Thank you.
Yeah, it's true that there is no global repertory of all the organization. We happened to know a few, none in Singapore, I have to admit, but yeah, we can think about a way to share with you some contacts or people that would be better suited to answer your questions regarding the Southeast Asian context, because I'm not 100% familiar with the landscape over there.
Yeah, and just to complement your question and your answer, Marco, I think that we as a network, we can also work together on that. I mean, we have Nick as the regional officer of the Asia region, and it's the same way that I'm just trying to move forward all the effort for the European and the relationship with Africa. In advocacy, we can just work together with Nick, and I think that this is something that as a network, we can move forward and push it for doing this this work in advocacy for the Asian region also. I mean, we do and a couple of things, but let's say nothing very nothing very structured. I mean, for example, for Europe, we have like an action plan, let's say, but it's something that we can replicate for Asia for sure.
Okay. Thank you so much. I don't think we have any other question, and we are running late. So I had a question, but maybe I will ask it to Yann and Lucile in another moment. Thank you so much to Yann. Huh? No, because I have another meeting. I'm sorry.
Okay.
Okay. So
okay.
But yeah, but thanks again, Yann, Lucile, for the seminar. Thank you, Cecilia, for your intervention. Thank you so much. We keep in touch, and I hope we're going to build many more collaboration all together for global health and for advocacy and global health.
I think one thing, I think that what is important just to mention is that Global Health Advocate is a partner of the Pasteur Network. So I think that every kind of initiative or thinking that you would like just to have a proposal, it's open. So you can do it.
Exactly. So our next monthly seminar will be on February 12th with Yasmin Bilkei, Director of IP Paris. She will be presenting the scientific strategy of the Institut Pasteur. So you are all welcome, and thank you again. Have a great day, and Happy New Year once again. Thank you again.
Thank you.
Bye.
Bye-bye.
Thank you.
Talk to you soon.
Thank you. Bye-bye. Happy New Year.
Thanks.
Bye-bye.